Here's this in black and white, okay? And before I get started, let me just tell you a little bit about myself. My name is Sue Denny. I am the Public Affairs Specialist for the Social Security Administration. I work in the downtown Federal Building, but I do serve all the offices in the Cincinnati area. My job is basically education and outreach. So I am out and about many times during the week discussing Social Security programs and benefits, sometimes to general audiences like this. Earlier today, I was at Xavier University. They did a pre-retirement seminar for their folks 55 and older. Tomorrow, I'm going to be doing another pre-retirement for some federal workers, and in the evening, I'll be talking to some clients of a financial planner. So I've been doing this job for almost 17 years. And it has become ingrained in my head how important Social Security is. It really is with you through life's journey. Most people, when they think about Social Security, they think about it as a retirement program, and certainly it is a very important retirement program. But there's other aspects of Social Security, other programs and benefits that we provide that cannot be forgotten, because they are equally as important. I'm going to say equally because for many people receiving Social Security, whether it's retirement, disability, survivor's benefits, it sometimes keeps them out of poverty. I have heard many times from people who have said, you know, my dad died when I was a kid and we wouldn't have made it without Social Security. So that's what we're going to focus on tonight. But I really want you and your questions to guide where we go. When I put this together, I wasn't sure who was going to make up the audience. What I've decided the audience is primarily made up of is people who are pre-retirees, maybe 55 and older, though there might be a younger worker or two out there. So if you are receiving a Social Security benefit already, raise your hand if you would. You're receiving. Okay, so that's most of you. If you're not receiving a benefit, raise your hand. Okay. So maybe it's a 50-50 split. So I'm going to stop periodically, if that's okay, Betty, to ask for questions, because if we can breeze over one of the topics, then we'll breeze over it. If we need to spend more time on a particular topic, then we will do that as well. So let's go ahead and I'm going to, if you will, I'm going to draw your attention to a couple of items on the sheet that says, what is Social Security? Let me give you a little bit of background. Back in 1935, the Social Security Act was passed. At that time, it was strictly a retirement program for retired workers age 65 and older. And not everybody was covered, far from it. There was not comprehensive coverage. It started out basically with a small population of workers, and over the last 8 decades or so has grown so that probably 98% of today's workers pay into the Social Security system. Some of you may be government workers in the state of Ohio. You may work under the Ohio Public Employees Retirement System. Anybody? State Teachers Retirement System? School Employees Retirement System? Civil Service Retirement System under the federal government? And then Ohio Police and Fire Pension Fund. Okay, so anybody who raised your hand, what that means is you're one of the very small percentage of the population where you do not pay into the Social Security system through your work. You pay into an alternative system through, say, OPERS, the Ohio Public Employees Retirement System. We do have a huge population of what we call non-covered government employees in the state of Ohio, but nationally, it's a small percentage. So 1935, that's when the Social Security Act was passed. We initially paid out a lump sum to individuals. And it wasn't until several years later that we actually started mailing out benefit checks. And we kept track of individuals' earnings with that new Social Security number, which has become basically a national identifier. But really, the Social Security number is supposed to be just a vehicle to record your earnings, the taxes that you've paid, so that the Social Security Administration can determine how much to pay you in benefits. But as I mentioned, we use the Social Security number for many things now, although fewer things than we did in the past. To prevent identity theft, for example, you will no longer find the Social Security number on your driver's license. That's not permitted in any state. If you're a college student or you have children or grandchildren in college, the Social Security number used to be your student number. That's no longer the case. Anybody on Medicare in the room? If you look at your red, white, and blue card, you know that your Social Security number or your spouse's Social Security number is on that red, white, and blue card. That is going away as well. And it's about time, because it has been recommended by law enforcement officials, by the Office of the Inspector General, that the SSN, that Social Security number, be removed from the Social Security or from the Medicare card, and it will be removed within the next 2 years, I believe. Talk about before the first paper check was mailed out, Congress realized that changes needed to be made to the law. Here's why. Think about 1935. What were most women doing back then? We were homemakers, that's right. We were staying home, taking care of the husbands and the houses and the children. So when the worker died, the husband died, the Social Security benefit died along with him, leaving many women and their children destitute. So before the first monthly benefit amount or benefit check went out in the mail, Congress had changed the law to provide benefits for survivors. That was in 1939. We do pay benefits to widows and widowers today. And we'll talk more about retirement. We'll talk more about survivors' benefits. Now, in 1956, what happened? The Social Security Act was amended to add disability benefits. This was to provide financial security for workers who became disabled before their retirement age. And unfortunately, even today, 1 in 4 of today's 20-year-olds will become disabled before they reach full retirement age. And I'm sure everybody in this room knows somebody who either died before reaching retirement age or became disabled before reaching retirement age. So again, Social Security is with you through life's journey. 1965, the Social Security Act was amended to add Medicare. That is the federal health insurance program for people 65 and older, and also for people with disabilities, people who've been receiving disability benefits for 2 years. Many people confuse Medicare with Medicaid. Let me try to make sure you understand the difference between the two. Medicare, the Medicare tax is deducted from your paycheck along with the Social Security tax. Those figures are matched by your employer. You become insured for a Social Security benefit, a cash benefit. You also become insured for Medicare Part A. Medicare Part A covers your hospitalization. Put it up. Were you indicating that you were having trouble? Okay. So So Medicare is for people who have worked, they've paid the Social Security tax, or their spouse has paid the Social Security and Medicare tax, and they become insured for Medicare and Social Security. Medicaid is for people with limited income and resources. This is a state and local program partially funded by the federal government. Again, it is for people with limited income and resources. In Ohio, the Medicaid program is administered by the Department of Job and Family Services. So that's the difference between the two. But as I said, people get these two programs confused all the time. A child is not there. There's one program, so it happens that a child could be receiving Medicare. But if you've got somebody younger than 65, it's very possible they're on Medicaid, although there is a segment of the population who are disabled who are also able or who also have Medicare. And again, that's the federal health insurance program. What happened in 1972? The Social Security Administration took over a number of programs that were offered from the county level, the state level. These were basically welfare programs. And the Supplemental Security Income program was established, SSI. This is a needs-based program for people with limited income and resources who are disabled. So children and adults may be able to qualify for SSI and get a monthly check if they are disabled and have limited income and resources. We also have a program called SSI for the aged. This is a program for people 65 and older who have limited income and resources. So with retirement, with survivor's benefits, with disability, and with Medicare, these are programs that are paid for through the Social Security and Medicare payroll taxes that we pay and that are matched by our employers. SSI, Supplemental Security Income, this is paid for out of the federal government's general revenues. Again, it is a welfare program. The bulk of our beneficiaries, the majority of them are retired workers, also their dependents. That could be spouses, could be children, it could be both. But we do, so it's important to note that we do pay benefits to the dependents of retired workers, disabled workers, and deceased workers. Social Security is a social insurance program intended to replace lost income due to a worker's retirement, a worker's death, or a worker's disabling condition. I know how important that monthly check can be. My mother actually received disability benefits for 20 years before she died at the age of 65 back in 2001. I guarantee you, my mother had multiple medical conditions, but was ill my whole life with rheumatoid arthritis and lupus. I know that there is no way she would have lived to 65 if it hadn't been for Social Security disability benefits. What I want to do now is I really want to open it up to cover the various topics that are of interest to you. So I am going to start first with retirement benefits. Social Security can pay retirement benefits to retired workers or to workers as early as age 62. If you take your benefits at 62, they will be permanently reduced, generally speaking. In order to get your full unreduced benefit amount, you have to be full retirement age, and that depends on the year that you were born. As I mentioned, the age for retirement benefits was originally 65, but now it's higher. The law was changed back in the mid-'80s to increase the retirement age. So if you were born between 1943 and 54, then your full retirement age is 66. If you're like me and you were born in 1960 or later, our full retirement age is 67. And then if you were born sometime between 55 and 59, your full retirement age is somewhere between 66 and 69, or 66 and 69. No, I'm sorry, 66 and 67. How do we calculate your benefits? Does anyone know? Do we use your highest 3 years of earnings? Raise your hand. Do we use your last 5 years of earnings? Raise your hand. Does that neither? Does anyone know how many years we do use? It is still 35. That's correct. So if you were filing for benefits today, and the preferred way is to file over the internet, we would look at your entire wage history, back to when you had your first job, scooping ice cream at the Dairy Queen. We would index all those wages for wage growth. We would bring them up to current day value. Then we would pick out the highest 35 years. We add those 35 years together and divide by 420. Why 420? Because 35 times 12 is 420. And what we're doing is coming up with a figure known as your average indexed monthly earnings. That becomes the basis of your Social Security benefit. You don't get that entire amount, you get a percentage. The average American, their retirement benefit equals 40% of their average indexed monthly earnings. Now, who thinks that Social Security was intended to be the only thing you lived on in retirement? Anybody? It wasn't. It was always meant to be a base, a foundation, to be supplemented with things like savings and investments and 401ks and IRAs. The average benefit this year in 2017 is about $1,360 per month. If that's all you got, you might be struggling to make ends meet. Who remembers what used to come in the mail every year showing what your estimated benefits would be? Anybody remember getting that? Is everybody aware that that's no longer coming in the mail? Well, it's no longer coming in the mail unless you are 60 or older. Okay. And then it comes in the mail if you have not created a My Social Security account. Okay. So the Social Security statement comes in the mail if you're not receiving benefits every year beginning at age 60. But it's too important of a financial planning tool to wait to get it in the mail. So let's talk about the Social Security statement. How do you get it? You get it by creating a My Social Security account. Who was able to create that account? Was everybody able to create that account? No, you had trouble. Okay. Let's talk about it. Gentleman in the green shirt.
I created one of those accounts years ago, and I'm dyslexic, so I can screw things up on the computer really bad. But I think I messed up my password or something, because what it does now, I can't get into it. And like I tried to contact, I went into the computer today before I came here and put my name and Social Security number, year I was born or whatever to answer the questions. It said it doesn't recognize me.
Okay.
So nobody hacked it. I mean, it didn't go away, did it?
And years ago, you were able to register. Did we call it the My Social Security account? I don't think we called it the My Social Security account. So you might have registered for online access, but it wasn't the My Social Security account per se. If I tell you what, I'm going to give you my telephone number because I want you to call me, and I can tell by looking at our system whether you have actually created an account or not. Okay, so I'm going to give you my phone number. Do not write it on the bathroom wall, please. 866-593-1519, extension 34656. If I'm not there and I'm off and out, leave your name and your Social Security number and a return phone call and let me know what you were calling about. Yes, it's 866-593-1519, extension 34656. So let me take a couple of steps back and talk about the My Social Security account. Also, there is a fact sheet on the left-hand side of your packet. It's the second, well, now it's the second sheet. It's called, it's red, white, and blue. And it's called How to Create an Online Account. This is what it looks like. So in order to create an online account, you do have to have a Social Security number, you have to be 18 or older, you do have to have a U.S. mailing address, and you have to have an email address. So we are going to ask you when you sign on, when you register for this account, we're going to ask you for some personal information. Your name, your date of birth, your place of birth, your mother's maiden name. We only want you to be able to create an account for yourself, because the information that's available through the My Social Security account is very private and confidential. Only you should be able to access it. Although I have to be honest with you, there's husband and wives can probably know enough information to create one for their spouse, maybe even an ex-spouse, but you are not allowed to create an account for somebody else. You are prohibited from doing so. So once you pass that first level of authentication with the name, the date of birth, the place of birth, then we're going to ask you a series of multiple choice questions based on data that we have from a credit reporting agency. These multiple choice questions might have something to do with, let's see, a vehicle license plate tag, an old telephone number, where you have your most recent mortgage or a credit card account, or it could be a question related to the age of your home. Once you answer these questions correctly, then you create a username and password. Now, I have to be honest with you. In my experience, the older you are, the more difficulty you're going to have answering these multiple choice questions, because they can go back years and years. If you look at a question and you say, this doesn't make sense, none of this applies to me, answer I think the last option is does not apply. That's what you would want to answer. We're not going to tell you which question you get wrong. You will be locked out for 24 hours, and then you'll be able to try again. Let's say you're locked out again. 3 strikes and you're out. Then your option would be to come into one of your local offices with a valid driver's license, and we can bypass those credit reporting questions and create an account for you. Any questions about that aspect, the registration aspect of the account before we move on? Yes.
I have a question. What is the benefit of an online account?
You took the words right out of my mouth. Let's talk about the benefits. First of all, if you are not receiving benefits, why do you want to create this account? Number one, you want to review your Social Security statement. I don't care how old you are. It's important for you to look at that statement if you are working or you have worked in the past. So those of you who aren't receiving benefits yet, you're creeping up there. I want you to look at your statement. But if you have grown children or grandchildren, please encourage them to create a My Social Security account as well, so that they look at their statement, because they will see estimated benefit amounts for retirement, age 62, full retirement age 70. Those estimates assume the person's most recent year of earnings is going to continue. You'll also see estimated benefit amounts for disability. If you were to become disabled and unable to work, that could be due to a physical condition, a mental condition, or a combination of both. You'll also see estimated benefit amounts for survivors. If you, the worker, were to die, leaving behind a dependent spouse or children or both, how much would their benefits be? And then you'll also see a line about Medicare eligibility. Have you worked and paid enough into the system to qualify for Medicare? Remember, that's that federal health insurance program that we talked about. Now, the other thing that I want you to look at when you're looking at your statement is I want you to look at your earnings. You're going to see all of your earnings, back to when you had your first job. We are going to pay you benefits based on the earnings that are posted. If the earnings are wrong, we're going to pay you the wrong amount of money in benefits. So that's why it's important to look at this statement every year. Let's say you see an error or an omission. If you provide us with a W-2 or a tax return or an end-of-year pay stub, we can make the correction because we want to pay you the right amount of money in benefits. So that's the main reason I want you to create my Social Security account if you're not already getting benefits. But there's other things you can do as well. In many states, you are able to request a replacement Social Security card online. Now, that service is not available in Ohio yet, but it eventually will be. It is available in Kentucky and Indiana, and Michigan, I believe, are some of the closest states. If you need some sort of verification that says, I'm not getting Social Security benefits right now, you can get that online through the My Social Security account. If you file an application with Social Security or you file an appeal, you can check the status of that application or that appeal through the My Social Security account as well. So those are the primary benefits for people who aren't receiving benefits. Once you are receiving benefits, why do you want to create a My Social Security account? Our motto is why go on or why stand in line or wait in line when you can go online. If you need to print a benefit verification, you can do that through the My Social Security account. Something that shows what you're getting every month. Maybe you need it because you're applying for a needs-based program or you're buying a vacation home somewhere and you need it for the mortgage. If you need a replacement 1099 because you're doing your taxes and you've misplaced the one that we sent you or you never got it, you can request that and print it out immediately. If you need to change your address or your phone number or your direct deposit, you can do all that through the My Social Security account. If you need to check on something, such as what day of the month do you get your check, or what is your direct deposit information, or if you have an overpayment, why do you have an overpayment? So there are also, once you're receiving Medicare, you can request a Medicare card through that My Social Security account. Now, for many people, they do prefer to do business online. We shop online, we bank online, they want to do their Social Security business online as well. But we want to serve you in the way that you want to be served. If you prefer to call our 800 number, you can certainly do that. If you want to visit a local office, you can certainly do that as well. But again, whether you're somebody starting out in your first job or whether you're thinking about applying for disability benefits or you're a couple years out from retirement, we want you to create a My Social Security account and look at your statement. Review your statement. Once you're on benefits, though, there's lots of services you can do as well that would allow you to avoid waiting on that 800 number or waiting in line at the Social Security office. Any other questions about the My Social Security account? Yes, and thank you, Betty. So Betty, we talked about this briefly before the session started today, and you know that the Equifax breach has been big news, and I saw that, I guess, the chairman resigned today. What happens when somebody gets a hold of your personal information? You can become a victim of identity theft. So you do want to perhaps put a credit freeze on your account by contacting the credit bureaus. But what about Social Security? What about your My Social Security account? Is it safe? Well, they've got your, if somebody has obtained your name, your date of birth, and other personal information, they can try to create that My Social Security account. However, you may have noticed when you try to create an account, or if you've accessed the account, that there is a security feature. And every time when you create an account for the first time, or every time you access that account, we are going to ask you for an email address or a mobile telephone number. Why? Because every time you access that account, or the first time you create it, we are going to send you either by email or by text a unique code. And you need to enter that code before you can access that account. So somebody could get your personal information. Maybe they're able to get that secret code. They also need to know your username and password. So it's going to happen, and because it has happened in the past, I mean, I have to be honest with you, identity thieves, crooks have gotten into people's My Social Security accounts. There's only one reason why they want to do that, and that's because they want to redirect your Social Security check. So if there's direct deposit information there, they can change it to other direct deposit information and divert your check. That's what you want to avoid. We have put safeguards in the system where any change that's made online is not made immediately. We actually send out a letter saying we have received your request to change your direct deposit information. This change will go into effect X date. But it's not going to be for the first check, the next check. It'll be at the following check. And again, that's a safeguard that allows you to be notified first in writing that somebody has changed your direct deposit information. Now, the other thing that I will note is we have had instances where people have come into our office saying, I got this letter that says I created a My Social Security account. I don't have a computer. I don't do any business online. Well, what that means is somebody has obtained their private information and was able to create and answer those Experian questions or the credit reporting agency questions and create an account for them. Can I tell you who that often is? It's a close friend or a family member. Please protect your information. Don't carry your Social Security card in your wallet. Put it in a safe place. The other thing is people will say to me, well, Sue, I'm told I need to carry my Medicare card with me just in case. That's not true. A hospital will not refuse to serve you just because you do not have your Medicare card with you. So unless you're going to a doctor or a hospital for the first time, there's no reason for you to have to carry that Medicare card with you. Again, put it in a safe place. Any questions about that? We do have information about identity theft online at our website. And most people, when they think about identity theft, they do think about Social Security. However, we are not the primary agency responsible for identity theft issues. That is actually with the Federal Trade Commission, the FTC. And they put out a great booklet about what you should do if you become a victim of identity theft. If you would like a copy of that booklet, you can order it online or download it online, but let me also give you my email address. And I have a supply at the office, and I would be happy to mail it to you. So let me give you my email address. It's Susan, SUSAN, .Denny, D as in David, ENNY, at ssa.gov. That's SSA, short for Social Security Administration, .gov, G-O-V, short for government. Susan.denny@ssa.gov. All right, any other questions about the My Social Security account or identity theft? So who else had problems creating an account? Do you know why you did, sir? Oh, she's coming up with a microphone. Sorry about that.
Who is it? No, they can't hear you online.
All right. So the trouble I had is I answered all the series of questions fine, but when I went to create my own username and password, it looked like it was accepting it, but then when I went down to finish, it came back up and said, "Oh, got to come up with another username."
Right.
So when I did that, then the password disappeared. And when I tried to change that, then it came back and said the username wasn't any good. So I did that a couple of times. I probably locked it up.
Okay. Let me address that. I'm not sure if I'll address it specifically, but so you're going to ask to create a username, and it's, you know how, it has to have capital letters and small letters and symbols and blah, blah, blah. And then once you create that unique username, you then create a password. Then you are asked to answer a series of password reset questions. So what was the color of your first car? What hospital were you born in? Where did you meet your significant other? These are questions that you should know the answer to and not forget the answer to, because you can reset your own password without contacting Social Security, but you have to be able to answer these password reset questions. And you would be surprised at the number of people who say, "Oh, I forgot." So if you've forgotten your password, you can call our 800 number and we will email you a temporary, email or mail you a temporary password. I can't remember which. Now, what if you have forgotten your username? What you can do is you go online to socialsecurity.gov to the page where you access the My Social Security account. You plug in your name and your date of birth, or your name and your Social Security number, and it will come back with your username. So that's actually a way for you to check. Will it come back with your username or your email address? No, I think it comes back with your username. And then you know whether you have created an account or not. And so try that, and hopefully that'll help for you. Okay? Any other questions about the My Social Security account? Okay, so what about questions about retirement? What do you want to know? Whether you're getting benefits now or whether you are going to be applying in the next couple of years or in the next couple of decades? Yes, and let's wait for the mic.
I'm more concerned about my benefits at only 43, considering there's what, maybe 3 workers to 1 beneficiary right now. What's it going to be like 20 years from now, or do you think they're going to go from 67 to 70, which I think is appropriate?
All right, let's talk about that. Basically, this is the future of Social Security. How many of you have heard Social Security is broke, Social Security is bankrupt? We are not broke. We are not bankrupt. Here's why. Social Security works like a pipeline. We are collecting taxes from today's workers and today's employers, and then we're paying those benefits to today's beneficiaries. So we're collecting taxes, then paying that money out to today's beneficiaries. So people who think, oh, there's a lockbox or there's a special account with my name on it and all my money's in there. Doesn't work that way. So will Social Security be there for you? The answer is yes. No, the answer is yes, and here's why. Even by the year 2034, Social Security will be taking in enough in FICA taxes to pay out 77% of benefits if no changes are made. That's by the year 2034, or in the year 2034. Up until that time, we're solvent. In 2034, if no changes are made, we will be able to still pay 77% on the dollar. However, changes need to be made. And the sooner they are made, the less drastic the changes have to be. One of the suggestions is to raise the full retirement age. That's already been done once. Used to be 65 for everybody. Now it's 66 to 67, depending on the year that you were born. There has been talk about raising the retirement age. And did you say you thought that was appropriate? And that is because people are living longer and healthier lives. It is not uncommon today for people to collect benefits for longer than they actually worked and paid into the system. So, and that's not how it was when the system was first established back in 1935. So there has been talk among the congressmen, the senators, about raising the full retirement age. There's been a couple of suggestions. There's also been talk about raising the early retirement age, which is now 62. You can take your benefits when you want to. The earliest is 62. You do have to be 62 for the entire month. So what that means is if you were born on the 1st or the 2nd of the month you turn 62, you could actually file for benefits if you wanted to. Now, my father, his birthday was April the 8th, and he felt like he got cheated out of his April check. Well, he didn't, but he could not file for his benefits to begin until May, and then his May check came in June, his June check came in July. So that was a little tangent. So there has been talk about raising not only the full retirement age, also the early retirement age. There's also been talk about raising the Medicare age from 65 to something else. All of this is talk. In order for any action to be, or in order for anything to go into effect, there would have to be an agreement by Congress, by the senators, by the members of the House. There would have to be legislation passed, and that legislation would have to be signed by the president. So these are considered major changes. Typically, Congress phases in major changes because there's been a lot of talk and people get worried. They're already getting a Social Security check or they're very near retirement, a couple of years out. Well, what's going to happen to my benefits? Well, Congress typically phases in changes, in major changes, so they do not have an immediate impact because it would not be fair to pull the rug out from underneath you when either you're getting a Social Security check or you expect to get one in a couple of years. We define a near retiree as somebody 55 and older. So I tell my audiences, don't worry if you're getting benefits or a near retiree because major changes will be phased in, more likely to have an impact on our children and our grandchildren, possibly early or late baby boomers. But again, I need to emphasize Congress can do what they want. So Social Security is the most effective anti-poverty program in the history of the country. Back in 1935, who knows what the poverty rate was among the elderly, 65 and older? Anyone want to take a guess? 50%. It's less than 10% now. The poverty rate is less than 10% now among people 65 and older because, in large part, not only because of, but in large part because of Social Security. Something does have to be done. You made a point that there's only 3 workers today paying FICA taxes to support every one beneficiary. Eventually, there will only be 2 workers paying those FICA taxes to support one beneficiaries. We are just not going to be taking enough in taxes to pay out all of promised benefits. But again, that's not going to happen till 2034, and that assumes no changes will be made. Anyone know how Congress acts typically? They wait till there's an emergency, and then they take action. So the sooner the better. If you feel strongly that the changes need to be made now, let your congressman know. Did I answer your question, or did you want to follow up? Okay. Okay, and I see, I mean, I guess what I'll say is 77% is better than 50 and it's better than 0, but it's not going to get to the point where we're going to do, I don't believe, and obviously, you know, I don't have a crystal ball. I don't know what's going to happen between now and 2034, but those we're not going to have to chop benefits by 25%. However, the changes that are made to shore up the system will likely result in some sort of a reduction in benefits. That could be an increase in the retirement age, like we talked about. It could also be some means testing. I don't know the specific proposals because typically I don't pay attention to them when they're only proposals because I try not to borrow trouble. Our responsibility at the Social Security Administration is to administer the laws as written. So there's so much legislation that's introduced, it lays there, it does nothing. So I'm not going to worry myself about it. Let's say that, the means testing. Let's say they say, well, if you've got a modified adjusted gross income of over $200,000, and I'm really just picking that out of my brain, you're not going to be able to get a Social Security benefit, or it will be less. Well, the reason Social Security has been so popular and universally accepted in the last 80-some years is because it's been fair. You work, you pay the tax, you collect a benefit. And if you take away that, if you make it means tested, then you take away the fairness and you take away the popular support. So, gentleman in the back.
Thank you. Can I ask a Medicare question?
You may ask a Medicare question.
Great. And first off, thank you for coming in and sharing with us your wealth of knowledge. This is very helpful, and I have heard you on the radio in the past, and you're wonderful. So thank you for what you do.
Thank you. And let me just put a plug in there. He's referring to Simply Money on 55 KRC. I usually do 2 shows a month on Ed and Nathan's show.
Yeah.
So
great. So my question has to do with my wife. She is a retired school teacher. She's in STRS. She has not paid into Social Security or Medicare much over the years, far less than the 40 credits required to be eligible. So when she turns 65, does that mean she is not eligible for Medicare?
All right, let's talk about that. Medicare. All right. First of all, are you positive? Has your wife created a My Social Security account? Because I want her to look at her statement and make sure she isn't eligible for Medicare.
Correct. That's what the statement says.
Okay. All right. Good. I mean, not good, but I'm glad you looked at the statement. She is protected, though, because you have worked and paid the Social Security tax. She will be able to get Medicare Part A for free as your spouse.
Great.
Now, She can do that at 65, but how old will you be when she is 65?
Late 50s.
So she will not be able to get Medicare at 65. She will have to wait to get Medicare till you're 62.
Okay.
Okay, so there will be a period. Here's how it's going to work under STRS. STRS is not going to require her to file for Part A of Medicare. She could, but it would cost a lot of money. How much money would it cost? Look at this update 2017 fact sheet. And on the back, the bottom half, it talks about if you don't have your 40 Medicare credits, how much would it cost you to purchase Part A? In 2017, if your wife has between 30 and 39 credits, she would pay $227 a month for Part A of Medicare. If she has less than 30 credits, she'd have to pay $413 per month. Now, STRS, as I mentioned, is not going to make her purchase Part A, at least the way it's written, the way the regulations are today. So for a period of time, her STRS retiree coverage will be her primary payer for hospitalization. Once you reach 62, she will be able to file for Part A and get it off of your record. Part B, she'll be able to purchase just like anybody else at 65 and pay the standard monthly premium. This year, that standard monthly premium is $134 per month. Okay, how close is your wife to that 65 age? Okay, all right. This is how it is today. I don't know if STRS is going to make changes. OPERS, for example, the Ohio Public Employees Retirement System, requires its retirees 65 and older to purchase Part A if they don't get it for free. But STRS isn't there yet.
Sue, I'd just like to make an announcement to the people online. You can ask a question if you're watching online. Just type it in and we will ask Sue the question. I don't think I said that in the beginning. I'm sorry.
Great. I'm going to take
Sue
this young lady right there and then somebody else over here. Okay?
I'm going to be 65 in May, and I worked 15 years in the Catholic schools, and I did pay into Social Security. I've worked 24 years with SDRS part-time, so I'm not going to get that much. How would that affect Social Security?
Okay. As I mentioned early on, we have a huge number of what are called non-covered government workers in the state of Ohio. One group of those workers is STRS, State Teachers Retirement System. What's your first name? Marianne. Marianne worked in the Catholic school system for 15 years, and she paid the Social Security and the Medicare tax. She has her 40 credits. She is eligible for a Social Security benefit on her own work record. She's also eligible for Medicare Part A without a premium. So that's the good news. The other news, well, here's what I'll tell you. In my experience, STRS has the most lucrative of the pensions, of the government pensions. So I don't necessarily feel sorry for you because you're getting an STRS pension. However, there will likely be a reduction in your Social Security benefit as a result of your STRS pension. You have to be collecting both in order for that reduction to go into play. Okay, so not as lucrative as some then. So your benefit through STRS, you said is going to be $635 per month? Okay. The maximum reduction, worst case scenario, is actually $400 and some dollars. The good news is yours will not be reduced by that much. You are going to benefit from something called the WEP guarantee, the Windfall Elimination Provision Guarantee. What that says is we cannot reduce your Social Security benefit by more than 1/2 of your government pension. So for simplicity's sake, let's say you're going to get $650, because I'm not a whiz at math. The most we could reduce your Social Security benefit is $325. We cannot reduce your Social Security benefit by more than 1/2 of your STRS pension. Okay? So for more information about this law, the Windfall Elimination Provision, you may want to go to our website. If you type into the subject box non-covered workers or government workers or WEP, you'll find more information.
We have a question here, and then we have a question from someone online.
Okay.
Here's the next question here.
I just had a question going back to the Medicare for the older wife and the younger man. By the way, congratulations. Did I hear you right, where when she is 65, she can still apply for Part B?
Yes, absolutely.
Wow, okay.
Anybody, almost anybody, I hate to speak in absolutes, almost anybody can, at 65, can purchase Part B. They do have to pay that monthly premium, but they can purchase it even if they have never worked, even if they've never worked and they've never had a spouse. Part B, that's the outpatient arm of Medicare. It covers things like doctor's visits, lab work, x-rays. Typically, Medicare will cover 80%, and then you or a secondary insurance will cover the 20% that Medicare doesn't cover. Part A, that covers hospitalization. All right, what other questions do we have? Okay.
Okay, first of all, let me tell you, we've had a couple of comments from people online commenting that you're very knowledgeable and doing a good job, so I thought I would pass that on.
Well, thank you very much. Will you let my boss know?
Janet has a question. How can I find out how much Social Security I'd get when my husband dies?
Okay. She is asking about widows' benefits, survivors' benefits. How can I find out how much I would be able to draw as a widow or as a widower? Because we do pay survivors' benefits. Once upon a time, we only paid them to women, but we do pay them to men and women. You need to contact Social Security. You need to, let's say, well, let me look at this two different ways. Your husband is still alive, you want to know, so you ask him, look at your Social Security statement, look at the line that discusses survivors' benefits, how much would I be due? Probably that's not what she's talking about. My husband has died. In order to draw widows or widowers' benefits, you have to be at least 60. Or if you're a disabled widow or widower, and we find you to be disabled, you have to be at least 50. You can contact Social Security. It's very likely that we already have her on the record. She probably collected a $255 lump sum death benefit. She was probably listed on the death certificate as the surviving spouse, so we will be able to tell her this is how much her benefit amount will be. Now, the longer she waits to take her benefit as a widow or widower, the higher that benefit will be. So she'll get 100% of her husband's benefit amount, but only if she waits till full retirement age to draw it. If she takes her widow or widower benefits early, they will be reduced. The earlier she takes them, the greater the reduction. So if she takes her widow's benefits at age 60, for example, she's only going to be due 71.5% of his benefit amount. But contact Social Security when it's time to file for benefits. That's what you want to do as well. Contact Social Security. That application for widows or widowers benefits is not available online. We can also, let's say that you're eligible for survivor's benefits, but also benefits on your own record. You can pick and choose which benefit to take and when, but you're not going to know. You contact Social Security and we can tell you what's most financially advantageous. Whose benefit should you take and when?
Okay, thank you. Wayne has a two-part question. At what age is the ideal time to get maximum payment, and when are you required to take it?
Okay, I'm going to take the easy question first, Wayne. When are you required to take your Social Security? There is no requirement. If you choose to, you don't ever have to take your Social Security benefits. I can't imagine doing that, but I'm sure there are some people out there who have chosen never to file for Social Security. When is the ideal time to take benefits in order to maximize it? Let me back up just for a second. Probably one of the most common questions that I get is, Sue, when should I take my benefits? If you look on the right-hand side of your packet, that first fact sheet that you'll see is when to start receiving retirement benefits. It basically shows that the longer you wait to take your benefits, the higher that benefit will be. Everybody's situation is different. There is no one size fits all. So what's good for you may not be good for you, may not be good for Wayne. There's a number of different things you need to look at to determine when should I take my benefits. Am I still working? How much am I earning? What's my health? What's my family history of longevity? You know, all kinds of things. Now, if somebody wants to maximize their benefit in terms of getting the highest benefit that they can, what they want to do is continue to work and wait until age 70 to draw so that they earn what are called delayed retirement credits. If you do not take your benefits at full retirement age, if you wait, for every month you delay, you earn what's called a delayed retirement credit. For every year you delay, you can boost your benefit amount by 8%. If you were born between 43 and 54 and your full retirement age is 66, if you wait till age 70 to draw benefits, you have increased your benefit amount by 32%. So that would be the way for Wayne or anybody else to maximize their benefit. Keep this in mind, however. If you take an early benefit at 62, for example, you take a smaller benefit for a longer period of time. If you wait to take your benefits, let's say till age 70, you take a larger benefit for a shorter period of time. Those two figures are actuarially equivalent, but there is a break-even point. So if you delay taking your benefits, you do have to live a certain amount of time and collect a benefit in order to make up for that money that you lost by not taking benefits early. And you know what? We don't know what life has in store for us. My sister died unexpectedly at 55 2 years ago, and my niece, she's grown, but she said to me, I'm mad at Social Security. I said, why? And she said, what happens to all that money that my mother paid into the Social Security system since she was 16 years old? Guess what? Goes back in the pot. My sister was single. She was divorced. She was not married 10 years. That's the requirement for divorced spouse benefits. All of her children are grown over the age of 18. None of them are disabled. She did not remarry. She doesn't have a new husband. So the money goes back into the pot. I mean, it's already there. It doesn't go to any survivors. Now, the way I like to look at it is our family has benefited from Social Security. My mother received benefits for 20 years, disability benefits. I had an uncle who was killed in a car accident at 40, and his 3 small children received benefits till they graduated from high school. My father has been receiving benefits for 21 years. So I like to think that that money my sister didn't get was spread around.
We'll take one more question online and then we'll go back to the audience here.
Karen would like to ask, when a husband and wife both receive Social Security, is there a limit to how much they can get as a family?
Husband and wife both get Social Security. Here's what I'm going to tell you. When we do not have a maximum couples benefit, we do not have a marriage penalty. So the husband's benefit was calculated on his record, his earnings history. The wife's benefit was calculated on her earnings history. I think this year, the maximum benefit is about, let's say it's $2,500. He could be receiving a $2,500 benefit. She could be receiving a $2,500 benefit. Combined income would be $5,000 in Social Security, and that's okay. I hope that answered her question. Anybody else have a question in the audience? Oh, here we have someone. The woman in the blue shirt. I'm sorry, repeat your question if you would, please. It is for Medicare. Okay, let me see if I can answer this question. If it's the question that you're asking. Non-covered workers, and are you a non-covered workers? Okay, we're talking about city, county, state employees in the state of Ohio, plus school teachers, school employees, and police and firefighters. None of them are paying the Social Security tax, which means they are not paying the Social Security tax, they are paying the tax for their government system, whether it's OPERS, STRS, or SERS, or whatever. However, if they were hired after the mid-'80s, then they are paying the Medicare tax. Now, it might not be called the Medicare tax on their pay stub, but that's what it is. And I'm looking at this fact sheet again. The Social Security tax is 6.2% on earnings up to $127,200. If you make more than that, you are only going to pay that Social Security tax up to $127,200. That's matched by your employer. If you're self-employed, you pay both the employee and the employer's share. Now, the Medicare tax is 1.4% for the employee, 1.4% for the employer, and that is paid on all earnings. So after the mid-'80s, the law was changed. All employees, regardless, or all employees hired after that date, regardless, have to pay the Medicare tax. So anybody who has worked and paid the Medicare tax through their non-covered employment is going to be eligible for Medicare at 65. Gentlemen in the back, I'm going to assume, even though you know what happens when you assume, I'm going to assume that your wife was hired by the school district prior to the mid-'80s, and that's why she did not pay the Medicare tax. If she had worked and paid into Social Security for at least 10 years, you know, in the summer or over her holiday break, if she had earned her 40 credits, she would be eligible for Medicare. But in her case, she does not have her 40 Medicare credits, therefore she can't get it on her record. But if you've paid the Medicare tax for at least 10 years, then you will be eligible for Medicare at 65. Okay? Go ahead. You have another question? Okay, her question is, what pays for Medicare Part B? You do.
Okay, so that's separate monthly.
That is separate monthly. That's correct.
Why is it called Medicare then?
Because that's the way the law is written.
And what pays for Medicare Part D?
Okay, let me talk a little bit about the various parts to Medicare. When I first started doing this job, I didn't get a whole lot of questions about Medicare. You had A and you had B. Well, now we have C and D, and it's gotten more complicated. I do want to emphasize, however, that Medicare is subsidized by the federal government. How much it subsidizes is going to vary. So let's talk first about Medicare A. This covers your hospitalization or a portion of your hospitalization expenses. You and I, we work, we pay the Medicare tax, we become insured for Part A, no monthly premium for 99% of Medicare beneficiaries, but there is a deductible. Okay, so that's Part A. That is partially subsidized by the federal government, but it's paid for out of the tax that we pay for during our working lifetime. Or it's paid for out of the taxes our spouse paid during his or her working lifetime. Part B, again, this is the outpatient arm of Medicare. It does cover doctor's visits, lab work, x-rays. It is subsidized by the federal government. However, it's not completely subsidized by the federal government. That's why this year the monthly premium per month is $134. Medicare, and you would use Part B if you go to the doctors, if you have a test done, blood work. Any outpatient service is typically going to be covered under Part B. Just like any insurance, there are costs associated with it, and that's what Medicare is. It is a health insurance program. Medicare covers 80%. You, as an individual, cover the rest of that 20%. Now, how many of you think that Medicare was designed to cover 100% of all your medical expenses in retirement? I had a guy tell me the other day, now what did he say? He said, I have to pay for Medicare? And he was like 64. And I was just very surprised that he was unaware that, yes, you have to pay for Medicare. Now, Part C, let's talk about Part C. Well, back up just for a second. If you have A and B, you're going to have to pay 20% out of pocket. So that's why a lot of people pick up supplemental policies. They're called Medigap policies, or they may have retiree health insurance, although the number of companies offering retiree health insurance is decreasing. So you have A, B, a Medigap or other supplemental policy, or a retiree health insurance plan. Now, if your retiree health insurance plan offers prescription drug coverage, you don't need a Part D plan. Part D for drugs. These are standalone plans that cover only prescription drugs. They're offered by private companies like Aetna, Blue Cross Blue Shield, United Healthcare. But you do have to pay a premium for them. If your retiree insurance offers prescription coverage, you don't need a D plan. If you have a Medigap policy, it will not cover your prescription drugs. Then you have to make a decision whether to enroll in a Part D plan, pay a monthly premium, and have prescription drug coverage. So that's D. Now, what are C plans? These are Medicare Advantage plans. Again, these are offered by private companies, Aetna, United Healthcare, Blue Cross Blue Shield, Humana. You enroll with that plan, just like with D, you enroll with that plan. With A and B, you enroll with Social Security. Part C, these Medicare Advantage plans, they offer other services as well. Health and wellness, vision, dental, prescription drugs. So whether you go to the doctor or the hospital or the drugstore to pick up your prescriptions, you have a test done, whatever, you show your Medicare Advantage card. Every time you use it, though, every time you use a service, you're paying for it. You're paying some sort of copayment or deductible. Now, the other thing to keep in mind about Medicare Advantage plans is these are HMOs and PPOs. So you are going to be restricted to certain providers, certain hospitals. When my mother was alive, she had, as I mentioned, she had lupus and rheumatoid arthritis. She was chronically ill my whole life. She saw Dr. Labowitz for 40 years. She would not have wanted to risk not being able to see Dr. Labowitz. So she would not have wanted to go, or she would not have gone to a Medicare C plan for all the tea in China. Now, for me, all I've ever known in my professional career are HMOs and PPOs. If you tell me, well, Sue, your health plan doesn't cover your doctor, I don't care. I don't care if I have to change my doctor. Don't ask me to change my hairdresser, but I have no problem changing my doctor. You pay for C, or you may or may not pay for C. Some, as far as a monthly premium. Some of these plans charge a monthly premium, some of them do not. If you look at traditional Medicare, you've got A and B. You've got a Medigap plan that you'll pay a monthly premium for. You might also have a prescription drug plan. I've heard that referred to as set it and forget it. You pay those monthly premiums and you've got your coverage. Part C, I've heard described as pay as you go. Your monthly premiums are limited. You have to have A and B, so you're paying that monthly premium for B. Some C plans have a premium, some don't. But anytime you use it, whether you're picking up a prescription or, you are going to be paying co-payments. So the healthier you are, the cheaper these Medicare Advantage plans are. So that was a long-winded answer to your question. Did it answer your question? Healthcare costs are rising. We all know that. I do some work with a financial planner. I'll do client seminars for him. He refers to your health expenses in retirement as your healthcare mortgage. I think that's about the size of it. We have another question here.
So we're getting close to the end.
To the end.
We do have another two questions online. I'm going to ask one of those. We do have someone online that would like to know how they could get a packet of this information. Now, we can keep some of those packets here, but if that individual doesn't come in here, how can they get that?
If they want to email me, I will mail it to them, or they can come in and stop here. So it's whatever. But also keeping in mind that all of this information is available online. Let me just draw your attention to a couple of things. On the left-hand side, what every woman should know. The information in this brochure pertains to everybody, whether you're a male or a female. However, women, typically we're the ones who have babies. So we're the ones who, when we go into the hospital to give birth, that's when the Social Security number is issued. Women are typically, but not always, the one who change our names on our Social Security cards due to a marriage or divorce. That's addressed in there. Women more frequently collect spouse benefits or survivor's benefits or divorced spouse benefits. That's why this is called What Every Woman Should Know About Social Security. The other is called Understanding the Benefits, and this is really our Bible. It's a summary of all of our programs and benefits. The right-hand side of the packet includes information about Medicare. There's also a fact sheet in there about how your retirement benefit is calculated and also when to start receiving benefits. Also, there's a brochure about how to apply for benefits. Many of our applications are available online. Retirement, spouse, Medicare only for somebody who is filing for Medicare at 65, but they're delaying their cash Social Security benefits. Disability application, that is also available online. So again, all this material is online, but if you want a packet, email me at susan.denny@ssa.gov, or come into the store and I'll leave you my extras.
One other question. Would you address the scenario of a couple that's married 10 or more years? They both reach retirement age. Let me back up. They divorce.
Okay.
They both reach retirement age. One of them has not remarried. And the other one, the one who has not, the one that married passes away. How does that affect the other one? And does it affect the male the same way it would the female?
First of all, it does affect males and females the same way. Used to be only divorced spouse benefits were available to women, but that has changed as well. She mentioned a 10-year marriage duration. That is only applicable in a divorce situation. So with a regular situation, if a husband and wife are married, that 10-year marriage duration is not required in order for benefits to be paid, nor is it required in a survivor situation. With a divorced spouse situation or a divorce situation, husband and wife divorce, they've been married at least 10 years, we will explore whether eligibility as a divorced spouse. Let's say the primary breadwinner has remarried. That's a guy, not necessarily, but it's easier that way. The man has remarried, has a current wife. He could have a current wife and an ex-wife both collecting divorced spouse benefits on his record. The most they are due while he's alive is 50% of his benefit amount. So if his benefit amount is 16, ex-wife could get up to $800. I'm sorry, $1,600. Ex-wife could get up to $800. Current wife could get up to $800. The ex-wife has to be single, though, when she files. Let's say that she did get remarried, but that marriage ended in divorce or death. Then that opens up her entitlement. We're going to pay her where she's due the most money. You are always paid on your own record first. So if your own benefit amount is greater than 50% of your spouse's benefit, there will not be any spouse benefits payable because you're only due 50%. However, your husband dies, your ex-husband dies. That means you could possibly be eligible for divorced widow benefits. He could have a widow and an ex-widow both collecting benefits on his record. If they wait until full retirement age to file, they can get that full 100% of his benefit amount, both of them. Here's a good way to end. If you are ever curious about whether you are eligible for benefits on somebody else's record, what are you going to do? You're going to call us. If you don't call us, you could be missing out on benefits. Any questions? Don't make assumptions. Don't say, well, my neighbor said, I don't care what your neighbor was told, that hopefully that was accurate for him. Doesn't mean it's going to be accurate for you. So if you have a question, contact us.
Okay, we can take one more question
Sure.
from somebody online and then we have to close.
Okay.
So if anybody still has questions, they can email you.
And also, if I could, I'd be happy to stick around for a couple of minutes.
Okay.
If I did not get to your
Okay,
question.
thank you.
Could you repeat your email address?
Yes, my email, Susan, SUSAN .Denny, D as in David, ENNY, at ssa.gov.
Okay, thank you. This is a question that came in a little while ago, so we're going to take it, but we are out of time. So Wayne is asking, if you are still employed, how much can you earn and still collect Social Security if you are over 70 and still working?
Okay, Wayne is over 70 and still working. There is no earnings limit after full retirement age. Once you reach full retirement age, which is somewhere between 66 and 67, you can work as much as you want, earn as much as you want, no reduction in your benefits. If you are younger than full retirement age, there is an earnings limit. That earnings limit is about $17,000. If you're younger than full retirement age, it's about $45,000. the year you reach full retirement age. I thought that Wayne was going to ask, I'm still working, do I have to take Medicare at 65? That is a source of great confusion. You do not have to file for Medicare at 65 if you are still working and covered under a group health insurance plan through active employment. I want to throw out a great resource for Medicare. It's called OSHIP. That's SHIP with a P. The Ohio Senior Health Insurance Information Program. And actually, Betty, that might be somebody you might want to bring in to really get into the nitty-gritty of Medicare.
Okay, I'll look into that.
Yes, it's OSHIP. OSHIP, the Ohio Senior Health Insurance Information Program, OSHIIP. It's a free, objective resource. They're not trying to sell you anything. They are located in the insurance department in Columbus, but they do regularly do outreach. Also, I'll make a plug for them. They do Medicare checkup events in all 88 counties in Ohio. Those are taking place right now because the Medicare open enrollment period starts October 15th. You'll find a schedule of those at their website. So I want to thank everybody for their attention today. I hope that this has been informative, and I will be happy to stick around and answer any individual questions you have.
Yeah. Thank you, Sue, and I think all of you will agree with me. She is the guru in our area on this subject. So thank you so much for coming tonight.